Do you know someone that has been diagnosed or affected by breast cancer? Both my mom and sister died from breast cancer at a very young age. My mom was 51 when she died in 2000, and my sister was 31 when she died in 2004. My sister had just had her second baby 2 years earlier. They both left behind many loved ones, and had we known more about this awful disease, they may be alive today. With October being Breast Cancer Awareness Month, I think it is appropriate to remind and inform men and women about breast cancer. I will be discussing exactly what breast cancer is, the risk factors, signs and symptoms, and most important, early detection. Before my mom was diagnosed with breast cancer, I had never known much about the disease. We had never had anyone in our family die from any cancer. Hopefully, by informing and reminding you, we can help detect early and prevent breast cancer. What exactly is breast cancer? Breast cancer is the uncontrolled growth of breast cells. Cancer happens as a result of mutations and abnormal changes in genes responsible for the healthy growth of cells. About 1 in 8 U.S. women will develop breast cancer over the course of her lifetime. A man's risk of breast cancer is 1 in 1,000. Breast cancer is the most common cancer in women except skin cancer. In 2014, 40,000 women will die from breast cancer. There are risk factors that you can and cannot control. Risk factors you can control include weight, diet, exercise, alcohol consumption, smoking, exposure to estrogen, oral contraceptive use, stress, and anxiety. These are factors that you have control of and can make a conscious choice to do or improve. Factors you cannot control include gender, age, family history, personal history of breast cancer, race, and radiation to chest. These are factors that you have no control of and cannot change. If a person has a healthy diet, normal weight, exercise, little to no alcohol consumption, and does not smoke, reduce stress and anxiety, and minimize the exposure to estrogen and oral contraceptives, they can reduce the likelihood of most cancers. Another risk factor is women who wait till after 30 to have a child. It will help reduce the risk of if a woman has a child before 30 and breastfeeds that child. Detection can be difficult at times. Women have different breast tissue and other variables that play a factor. In the beginning, breast cancer may not present any symptoms. Breast lumps may be too small for you to feel or notice any unusual changes on your own. Education about breast cancer is another factor. If we educate more people about monthly self-breast examination, we could decrease the likelihood of cancer being too far along before it is found. Some signs and symptoms of breast cancer may include swelling of all or part of the breast, skin irritation or dimpling, breast pain, nipple pain, or the nipple turning inward, redness, scaliness, or the thickening of the nipple, or a lump in the underarm area. These changes can also be a sign of less serious conditions, including infection and cysts. This is why early detection is best. Whether it is or is not cancer, it needs to be found as quickly as possible. And that is why self-monthly breast exams, yearly breast examinations by physicians, and mammograms if you are over 40 years old may be suggested to detect breast abnormalities. If you have a strong family history like mine, a physician may suggest a yearly mammogram to keep a closer look on things. There are many organizations that help give free mammograms to people that cannot afford them. One I used when I was younger was the Susan G. Komen Foundation. I have discussed what breast cancer is, signs and symptoms, risk factors, and early detection. in hopes to inform even one person how to prevent or detect early breast cancer. With October being Breast Cancer Awareness Month, I think it is appropriate to remind and inform men and women about breast cancer. While losing my mom and sister has been hard, it is my hope that you will take what you have learned today and pass it along to someone else. You could save someone else's life. Thank you.